Causes and treatment for hormonal acne. So, do you suffer with hormonal acne? Maybe you're not sure if it's hormonal acne or not, and you're wondering why you actually get it and how you can treat that acne naturally. So, hello, I am so thrilled to be here today. For those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath. I am a naturopathic emotional release practitioner and a natural fertility educator. And I help women struggling with their menstrual cycles have easy, pain-free periods, hormone balance, and emotional well-being. And I am the founder and director of Reproductive Wellness, which is a clinic located in Melbourne, and I see patients both online and face to face. So if you have any questions or comments as we go through the live today, be sure to pop them in the chat box down below, and I would love to answer those for you. If you're a little bit shy, you can always ask privately if you like, send a PM or a DM, and make sure that you hit the likes and the loves to make sure that I know that you're enjoying the content today. Hormonal acne. So acne, otherwise known as acne vulgaris, is a chronic inflammatory disease of the skin. And acne can occur due to a multitude of different reasons, but one of the reasons that we will be speaking about today is due to hormonal imbalances and fluctuations in hormones as well. So some women have flare-ups prior to their period or during their period, and this is because in the second half of the cycle, which is known as the luteal phase, so post-ovulation, estrogen and progesterone will both drop prior to your next period. For others, hormonal acne may be consistent and may hang around most of the time. Yeah, thanks for that. Symptoms of hormonal acne. So, during puberty, the acne will appear in the T-zone, so typically around the forehead, around the nose, and the chin. During the adult years, it might be more on the jawline or sort of around the lower cheeks or the chin. And that isn't set in stone, but it just gives you an idea of the presentation for that particular age group. So there are different variations of how the acne may appear on your skin, okay? So number one is comedones. So funny little name, but that's a type of acne, okay? So there's two different types of comedones. One of them is whiteheads, so they're known as closed comedones, and they look white in appearance at the top of the skin or at the surface of the skin, and they're closed beneath the skin surface. The second type of comedome is blackheads, so they're open comedomes, okay? They look black in appearance on the surface of the skin, and they appear that way because the sebum or the oil is actually interacting with the air and making it turn black. Cysts. So that's not a type of comedome. This is a second type of how acne can actually appear on your skin. So cysts can be large, painful lumps that contain pus, okay? The third type of the way acne might present on your skin is papules, or affectionately known as pimples. So that is an infection or an inflammation of the hair follicle, which results in red, raised, small bumps, okay? Just a little note on that as well, in terms of the papules, in terms of the comedomes, so the blackheads and the whiteheads that we spoke about earlier, if you actually touch or pick those comb domes, it can lead to the follicle wall actually breaking down, and this will actually arise in a rupture. But also it can spontaneously rupture as well. And when this happens, there's bacteria and sebum, which is the oil from the acne, spilling out and spreading onto the skin and the areas surrounding that. So that arises in inflammation, and then it can present as papules, or aka pimples. So it's an inflammatory type of acne that will appear there. Okay, the fourth type of presentation of acne can be nodules. So nodules, they're similar to papules, so similar to those pimples, but they're larger in size, and it's situated deep in the skin, and it's rather painful as well. Now, the fifth type of acne presentation on the skin can be pustules. So these are pus-filled, small red pimples. Okay, so that's the fifth type. So there's 5 different ways it can present on the skin, and yes, you can have a combination of these types as well. That's pretty possible. Hormonal acne causes. So situations or conditions that impact hormone balance can trigger acne. So I'll list all those for you. So it could be due to polycystic ovarian syndrome. So there's variations in hormone imbalance there, typically high androgens. So hormones like testosterone, for example. There can be insulin resistance. There can be high glucose. And all those kind of things going on, and there can also be high estrogen as well. So all that sort of all that hormone imbalance can trigger acne, particularly the androgens or high testosterone and the high insulin or insulin resistance that can trigger it mainly. Polycystic ovaries, so this is when you have cysts on the ovaries, however you don't have the syndrome, so you haven't been diagnosed with that. And the thing is, this can kind of behave in a similar way to the syndrome, particularly in regards to high insulin, high glucose, and that can trigger acne as well. Another reason could be high levels of androgens or male type hormones. So high androgens, especially testosterone, arise in an increased production of and secretion of sebum, which is a natural oil that occurs on our skin, but we don't want too much because that will actually promote and aggravate acne. Low progesterone, so that can be another situation as well. So adequate levels of progesterone are required to inhibit 5-alpha reductase, which is an enzyme needed to convert testosterone into DHT, which is dihydrotestosterone. So dihydrotestosterone is another androgen, but it's much more potent than testosterone. It's actually 5 to 10 more times potent than testosterone. So if you've got low progesterone, this leads to more DHT or dihydrotestosterone being produced, okay? And this increases sebum or that oil on the skin, and it aggravates acne. High insulin, so that can be another causative factor as well. This can cause a rise in insulin, which leads to an increase in androgens, so it can actually boost up hormones like testosterone by having that high insulin there. And there can be a decrease in sex hormone binding globulin, which is meant to mop up excess hormones. So if it's not binding and mopping up excess hormones, hormones such as androgens, like our testosterone, can actually roam free, and it can be in excess then. And this leads to more sebum and more acne. Another thing that can result as well is that it can stop ovulation as well. having these high androgens can impact ovulation, and so can high insulin as well. And the thing is, we need to ovulate to be able to produce progesterone. So yet it's another compounding problem to that situation as well. Post-pill. So this is caused when you've stopped the combined oral contraceptive pill, particularly one that contains an anti-androgen progestin, such as, and I'll try and pronounce them, sometimes I'm not very good at the names of pronouncing names of drugs and things like that, but I'll have a go at it, such as cyproterone or drospirenone. Yeah, okay, I've given you a bit of a giggle for the night. Or it could be just an anti-androgen progestin. So that's a synthetic progesterone. Now, this is when you stopped taking that oral contraceptive pill, there is a temporary surge in androgens or hormones like testosterone, and this is usually temporary. However, for some women it can stick around for a couple of years, so it's quite a long form of temporary, really, isn't it, for some women. So this can result in temporary post-pill PCOS. Okay, so this is a form of PCOS, and it's typically presenting when you didn't have signs or symptoms of PCOS prior to being on the pill, but you went on the pill and then after that you seem to present with this post-pill PCOS. So there is a little bit of a difference there. Puberty, so that's another causative factor as well, because during this time there's fluctuations in hormone levels as the ovaries have just, they've got their training wheels on, they're learning what to do and trying to get the hang of things. Okay, so the medical approach. The medical approach to hormonal acne is typically oral contraceptives like an anti-androgen progestin or the combined oral contraceptive pill containing an anti-androgen progestin. And this is used to reduce the production of sebum that is being promoted by those high androgens, and it will also increase sex hormone binding globulin, which binds up and mops up those excess hormones such as testosterone. But the thing is, this is not a good strategy because it's not addressing the reason why you've got that hormonal acne in the first place. So as you have already gathered, all those reasons before are kind of explanations as to why you've got the hormonal acne. So it's different for everyone, and you need to work out why it's actually happening. For example, if it's due to PCOS, you need to look at managing insulin, glucose, because they contribute to high androgens as well. You need to reduce high androgens, so there's male type hormones. You need to address any gut dysbiosis, which results in hormonal imbalance and acne. So yeah, there's that. And additionally, once you stop taking the pill, there's a high probability that you'll end up with rebound acne, and it may be worse than what you had previously. And it will come back with a vengeance because your sebum has been suppressed to that of a young adult. So once you come off the pill, your body realizes, oh, hey, wait a minute, she's an adult, she's not a young adolescent anymore. So, we need to produce more sebum to try and match that adult phase that they're in. So it will overproduce sebum as a result. And because of that, there'll be an overproduction of that oil on the skin and androgens as well, because it's trying to catch up. And typically post-pill acne will start about 3 months sort of after stopping the pill. Just when you thought things were okay, it will kind of spring upon you in that way. Sometimes antibiotics are used as well as another strategy to try and kill the bacteria that's causing the acne as well. But again, this is not a great strategy to be using. There are other alternatives because you're killing off both the good and the bad bacteria in the gut, and that's very important for hormone balance and inflammation management, which all contribute to acne. So once you come off, again, you're making the situation worse and the acne comes back again, okay? So what are some natural things I can do to treat my hormonal acne? So it's important to remember that the skin is an internal job. It's all very well popping on creams and gels and ointments, etc., externally, but at the end of the day, you need to treat the cause and treat why it's actually happening for you as an individual. But it is a good addition to internal treatment. So I'm just going to mention a few little tips today for you to use externally, okay? And there's many more to add to this, but I'll just mention a few today. So number one, so use an antimicrobial cream or oil. So I would suggest using either tea tree oil or golden seal. So there's this product called Botani Phytoseptic, and this contains golden seal. You can find it at health food stores. And applying either the tea tree oil or the phytoseptic cream directly to the acne spots only, not to the whole face because it will be too drying, but just to dry out those spots. And it's an antibacterial, antimicrobial agent. It reduces inflammation, and it's been shown to decrease the amount of acne lesions as well. Do not pick or squeeze your acne. As tempting as it is, this can arise in inflammation and it can spread bacteria and leads to more infection of the skin, okay? Don't use harsh products to wash your face with. So gel cleansers, for example, will strip your skin of the natural oils that it has there for protection, because we do need sebum to protect our skin. So it will strip all your natural oils away, your skin will dry out, it will be more irritated, and in response your body will go, oh, it's so dry there, I'm going to make more oil. And what happens when we've got too much sebum or oil there? Acne, okay? So in terms of what I would recommend, I would go for something like a cream cleanser. So for example, Antipodes makes some beautiful cream cleansers. They've got a few different types there. And Botani as well have a beautiful, gentle cream cleanser to use as well, so it doesn't strip away those oils that you need on your skin. So can a naturopath help with hormonal acne? So yes, absolutely. And I recommend seeing a naturopath that specializes in periods and hormones like myself to help support you, to help address those causative factors, remembering there's several different reasons why you might have hormonal acne. So we need to work out why it's happening for you and then develop a treatment strategy based on that. And treat it from a holistic perspective, not just the external, but looking at the internal, what's happening inside that's triggering and causing that acne. So treatment wise, we would be using things like herbal medicine, nutritional medicine, based on the reasons why it's occurring for you as an individual, along with diet and lifestyle. They're also extremely important as well. That can't be underestimated. And I also use NER, or Naturopathic Emotional Release, to clear any underlying emotions or stress in regards to that physical presentation of acne. And I usually find that there's several underlying emotions and stress that are contributing to that as well. So there can be several contributing factors as to why you've got hormonal acne. So in terms of treatment, I would be looking at, is it due to hormonal imbalance, which it would be because it's a hormonal acne. So looking at your girly hormones, so estrogen, progesterone, testosterone, and other androgens and things like that. Just as a start, there's many more I'd check as well. Pancreatic hormones as well, just checking in, seeing what they're doing, so insulin, glucose, for example. Stress as well, looking at stress, because stress can delay ovulation. If we don't ovulate, we don't have enough progesterone, and then we make more of that nasty DHT, dihydrotestosterone, which is 5 to 10 times more potent than testosterone. Gut dysbiosis, so looking at the gut as well, even if you don't particularly have any gut symptoms, when you've got a hormonal imbalance, you'll typically have something going on with the gut. There might be an imbalance of good to bad bacteria that's affecting the clearance of hormones from your body. Extremely important for hormone balance, okay? Looking at digestion as well. What's your digestion like? Is your liver working efficiently? We can check that through bloods as well to see what your liver enzymes are like and get an idea of what your digestion is like as well. Digestive secretions, are you making enough hydrochloric acid to break down food properly? This is all going to affect the gut ultimately as well, because it all ends up there and it can result in hormone imbalance too. So, any questions before I finish up this evening? I was trying to keep it as brief as I can, but I was very passionate about this topic tonight and really excited to talk about it. But let me just check Facebook. So no comments yet. That's all good. So if you think of anything later or you're watching the replay, please feel free to ask. And if you would like support with hormonal acne, I would love to help you. So feel free to go ahead and book a free 15-minute discovery call with me. If you're watching on Instagram, there's a link in my bio. So just pop over there and click the link to book your call. If you're watching on Facebook, I'll pop the link down below. If you're watching on YouTube, I'll pop the link down below for you as well. So yeah, I would love to help you find the causative factors to that hormonal acne. And on that discovery call, we'll find out more about how we would be working together and if we're a good fit as well. Now, remember that all my Instagram and Facebook lives are actually on my website blog as well. So if you head to reproductivewellness.com.au/blog, they'll all be there, and I've got the video at the top and the written script underneath if you're more of a visual learner as well. And I would like to thank you so much for watching this evening. I really, really appreciate you. And if you're watching on my YouTube channel, be sure to like and subscribe so that you don't miss any future videos. And FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about periods, hormones, menstrual cycles, and women's health. So I look forward to seeing you next week. Thank you so much. Bye.